I am happy to be talking to you again on this Monday as we have another one of our regular sessions for COVID-19 and talk about the things that are happening here in our community. There's been a lot going on, and I want to talk about coronavirus and COVID-19 and the issues involved in our economy in just a minute, but let me make sure that I start with a quick update on our storm and the tornado that reached us a week ago. So, as everyone knows by now, our area was ravaged by tornado in the early morning hours of last Monday and late nights of the Sunday before. We saw tragedy as a result. 3 deaths, 17 people transported to the hospital, and of course, more than 100 families who were impacted by the devastation wrought on their homes. We have been estimating several $100 million worth of damage as a result, and these families are going to be living with that every day for the next several months, whether you were friends or family with somebody who passed away or was injured or is just dealing with the issues involving their home. My heart goes out to each and every person. On top of that, we know that 60,000 people lost power. Within a few days, 51,000 had gotten that back. And as of today, I know there are still a few hundred people who are left without power, but EPB, as well as our crews, to make sure that things are cleared, have been working round the clock to ensure that we can, clean up as much as possible in the area and then get the power lines back working. The response of Chattanoogan's, as always, was amazing. We had over 1,700 volunteers come to the assistance of people. That's just incredible. 1,700 people, even in the midst of a global pandemic, who wanted to go out and help their neighbors. Thanks to all of you, whether you donated or went out there to East Brainerd yourself. You really made a statement about who we are as a community. I'm so proud to be part of a city that will do that, and again, appreciate you so much. On top of that, our first responders and public works department were just incredible. In just a few days, our public works crew and the others who are associated with it ended up hauling off close to 2 million tons of debris. Again, 2 million. 2 million pounds of debris, excuse me. And that is just an amazing number. That involves round-the-clock work each and every day. And so to the public works employees, to our first responders, we appreciate you very much. So now let's talk a little bit about COVID-19 and coronavirus. As of today, the Hamilton County Health Department says that we've had 121 cases and 13 deaths. That is an extraordinary number of deaths in our community that impacts a lot of different people. And I know you, as I am, are thinking about each and every one of those families and praying for them. In addition, of course, there are people who have recovered and people who are still suffering, and so we pray that they get well. Last week, the Hamilton County Health Department announced a huge expansion in testing. So if you are interested in getting tested, even if you don't have symptoms, there is now capacity for you to do so. I'm going to read the number, 423-209-8393. So again, you can call the Hamilton County Health Department at 423-209-8393. Schedule an appointment. Don't just go out and try to get tested. Call the health department if you're interested. Talk to them. Schedule an appointment, and then you're able to go out there. I wanted to talk a little bit. I know I've gotten a bunch of emails from people because there were protests around the country this weekend, including in our community, about the orders. And I absolutely respect people's right to disagree, certainly with me and any other elected official. That's what you should do, and speak out. And we're listening to people. I promise each and every one of you that it was not, never has been, and never will be my goal to issue executive orders. That's not what I want to do. At the same time, we know that we're in the midst of an unprecedented global pandemic, that we're seeing these responses around the country, that we have to keep people in our community safe. And I am reluctant always to use government power, but I also understand that things that if we don't keep people safe, that there can be drastic health consequences for you, for your loved ones, for other people in the community, and I take that very seriously as well. And so acting within my legal authority, as we've done since the beginning, is consulting with lawyers, making sure that we understand what the parameters are. Everything that I'm doing is attempting to make sure that people are safe and that they're healthy, and that we protect people, listening to experts and also coming to the best conclusions. That includes opening the economy. So I can see Tiffany on here asking about, am I going to let Chattanooga open up on May 1st? And then Alex is asking me, what are your thoughts about the governor's decision to let the shelter-in-place order expire on April the 30th? These are many of the questions that are in here, and I'm going to answer some of the questions that I know people have emailed, but let's start with this. So today the governor announced that in 89 of the 95 counties in our state, that he was going to let the shelter-in-place order expire. Now, that does not apply to Hamilton County, where Chattanooga is. It also doesn't apply to any of the big four counties, so Shelby, Knox, Davidson, and Hamilton, as well as Madison, which is where Jackson is, and I believe it's Sullivan County up in Upper East Tennessee. So those continue to have their own orders in place, and we're going to continue that as well. That's the right thing for us, is to make a decision based on what's best here in Chattanooga and going on right here at home. I certainly understand that the governor is going to try to make the best decision for the state, and but at the same time, he has consistently said, both to me, to the other mayors, and I think public, that he believes that these decisions are best addressed locally, and we're going to continue to make the best decisions that we can each and every time that we're faced with them. So today, actually just before this Facebook Live, the Big Four Economic Restart Group met. This is a task force of physicians, experts, business people, and community members from across the state who are discussing what will be best for these metropolitan regions. And we know that Chattanooga, Knoxville, Nashville, and Memphis don't necessarily look like every other place in Tennessee, and we have to have our own rules that will make sure that people here are healthy. As I said earlier, the governor has said that is fine with him, and has left that option to us, and we're going to continue to work through that. We are going to work extremely hard this week to ensure that we're going to be. I am going to be listening to experts. I'm just going to tell everybody that. I'm going to continue to hear what public health officials say. We have to filter that through what is going on with our business community. It has to make sense for everyone. And as I've said in other Facebook Live chats, most people just want to know what the rules are and what's going to be healthy and best for them. I know that there are many people out there who are trying to politicize this for whatever reason. That's not what I'm going to do. Don't want to do it. Have no desire to do it. This is a global pandemic. and we have to listen to experts. We have this triple-barreled issue right now with an economic stoppage, a global pandemic, and then the just mental health issues, I think, for people staying inside. I would call them spiritual, maybe is the better word, issues of how people are feeling given that they're not supposed to go out. And so, as we go forward, we're going to have to be creative and thoughtful in the solutions that we come up with, and that's what our Restart group is doing. So let me get to some of the questions that I have here from the group. The first question comes from Tricia, and Tricia asks, Governor Lee has decided to end the statewide stay-at-home order on April 30th. What does that mean for Chattanooga? Will businesses be allowed to reopen using enhanced safety measures? And so I appreciate that, Tricia, and I'm going to continue to make sure people understand this because it is really confusing for everybody when you have all these different pronouncements from different forms of different levels of government. So at the federal level, President Trump is saying one thing. At the gubernatorial level, Governor Lee is making a serious pronouncement. And then here locally, I and Mayor Coppinger might be saying something else. That is absolutely not ideal. And I wish that we were able to be much more in line with each other. Nevertheless, what we've got to do is make sure that we're doing the right thing for our community. Since I've been mayor, that's been the number one task. And so for us, what we're going to do is look at the numbers. So if you just think about it from my perspective, and I think from people who are trying to decide what's best here locally, we have a couple of different things that we're doing. Number one is I'm listening to experts, talking to public health officials, making sure that I understand what the standards are. We're trying to come up with the best framework to make sure that everybody is safe, but also that we're being responsible and open up the economy. And one of the biggest factors that I know I'm going to be looking at for the next 2 weeks is testing. So there was a period of time where we had extremely limited testing, and now that has been greatly opened up. We need to continue to look at that over the next several days, see where we are as a city. I promise you, nothing would make me happier than to know that we had contained virus as much as possible, and for us to be able to open things back up. I think that's everyone's hope and wish. We gotta follow the numbers. We gotta look at the information. We gotta listen to experts. We know that acting early here in Chattanooga has helped us on our curve. We know that closing down before many other places and putting down some restrictive orders has allowed our numbers to stay low. But we also understand that there has been a testing lag, and we got to take a look and see where that is. So we're coming up through the task force with the right frame to look at this, to say, okay, let's not just make this on arbitrary dates to say May 1 or May 8th or anything else. Let's look at what the numbers say and what's best for people, decide it best based on facts, and that's what I'm going to be doing, and certainly try to make sure things open up safely and healthily at the earliest possible date. The next question comes from Charlie, and Charlie asks, what is the current timeline for things opening up? What are the things that are standing in the way of opening up, and what is being done to correct that? So thank you very much, Charlie. I appreciate that, and or Charles, I should say. And I know that this is a big question for people. So if you listen to experts, what they want to see are a couple of things. Number one is they want to see the numbers steadily declining. in the cases that you have, and part of that is knowing that that very few transmissions are occurring per person, and so part of what you want to do is to make sure that for every person that tests positive, you can go out and do what they call contact tracing, which is see who they've talked to, see who they've been with, and then go talk to them and say, hey, you were in contact with somebody who now has been tested positive for COVID-19. You need to isolate, you need to quarantine, whatever the right piece of information is, you need to get tested so that we don't continue the spread. So we need to know that, number one, the numbers are going down, and number two, that we have the capacity to ensure that every person who tests positive, that we can go through and talk to everybody, to warn them, to make sure that they're doing what they need to do to be safe, and that way ensure that our numbers don't creep up. The worst thing that we can do is open things back up, see our numbers rise quickly, ensure that that means that more people are getting sick. It also means that people are just going to stay home. People really need to feel safe and to be safe when we open things back up. So getting the right rules is important. There was a question on here. I may have that said apply for dollars for community, and I can't find that question on the chat right now. But let me just say that we know as a government that the demands on us are bigger than ever because lots of people are in need. There's a tremendous amount of hurt going on in our community. People have been laid off, they've been furloughed, they are struggling out there, and they need food, they need assistance, they need rent money. There's just a million different problems out there, and it is breaking my heart to see all the issues that people are facing, plus frequently health issues on top of that. So we've got to be mindful of keeping our government running as best we can, and by the same token, we know that there are dollars that we are used to having in government to fund us, like sales tax, like hotel motel tax, that because things are closed, they simply aren't there. And so you can hear the federal government is having a debate right now about whether to help state and local governments, not because of any reason other than we're not seeing these dollars come in, and the demands on us are greater than ever. On top of that, last week we had a tornado that, as I said, involves lots of different services. So we are applying for every dollar that we can seek from the state and federal government. On the tornado side, that means going through FEMA to ask for reimbursement for all the dollars that are related to the tornadoes last week. That means on the state side, any dollars that we're using for the COVID-19 response to tap into state dollars. But there is going to continue to be issues because we need to make sure we are providing all the different services that people need in this very trying time, and local governments like Chattanooga's and all over the country are struggling to have the resources to do that. Meredith asks, Meredith says, thank you for all that you continue to do for our city. Could you order employees to continue to keep non-essential employees working from home even after we are back to normal? This would be huge for the Chattanooga traffic problems and save lives. So thanks for that, Meredith. And this is one of the things that that certainly we're talking about in our economic restart group. Are there ways to keep non-essential employees more at home so that you create more distance between employees in the workplace? Certainly at city government, we're thinking about how we do that, and we want to ensure that we're practicing the best possible use of our resources and modeling that for other employers. And so we're continuing to do that. I know that employers themselves right now, separate and apart from whatever government is going to tell them to do, they're having that discussion because they don't want employees to come back and get sick. It's bad for them. It's bad for their employees. It's bad for their reputation. So it's in the best interest of everyone for us to open back up safely. Matt asks, what are your plans for allowing kids to get out and play golf at all the courses in the city? My children are desperate to get outside and get some sunshine and exercise. From what I understand, all the courses outside the city limits are packed. The courses in neighboring counties and cities are playing golf around us. Why is golf singled out? So thanks for that, Matt. And part of what I want to do is talk to you a little bit about the way I think about essential and non-essential. So, I've talked a little bit about this in the previous Facebook Lives. We think about what are the essential businesses. For example, we don't allow gyms to open, but we do allow people to go out and exercise because just you going out and exercise doesn't involve all the activity that comes with putting a business together and putting it in place. And so we have closed golf courses in the city. It's a business that has employees and lots going on and generates a lot of activity, and we haven't included that as an essential business. So for me, as we look at this economic restart and thinking about what the future holds, golf is certainly on the list. I've closed many things that have been painful for us, like trails and parks and all kinds of things that I myself enjoy doing. I enjoy playing golf and have played golf for a long time, but we know that we have to keep people safe. We want to keep as many people as we can at home. It is shelter in place, and so we'll continue to look at golf just like we do these other businesses. Anna asks, CDC recommends wearing face covering, which protects people from germs in case you are infected and don't realize it. Therefore, do you anticipate an order similar to Los Angeles, where the customers of an essential business are required to wear a face covering while inside? Additionally, wouldn't it be prudent to require the employers of essential businesses to give masks or face coverings to those employees whose jobs require them to be in contact with other people when they are working? I would be more inclined to support businesses that had these safeguards in place than a business that did not. So Anna, I think, is making a really important point. We want people to understand what the rules are and what's safe, because if we don't create that expectation and have people feel safe when they're going out, then whether the businesses are open or closed, they're not going to be able to make money. And so by making sure that things are safe and that people trust it, we're giving these businesses the best chance to succeed. And so what we're looking at, for example, are the best rules, like wearing face masks, that we may be able to ask businesses to do so that they can open up. Maybe the businesses that involve customer contact. And the Economic Restart Task Force, which met for the first time today, is examining those issues as we speak. I've been wearing a mask when I've been going outside. I went to examine a site earlier today and put on my mask. I don't mind saying that I feel a little awkward. I'm just not used to wearing them, but I know that it protects other people from me, and that's the right thing to do. And so I encourage everybody out there to wear a mask if you're going out in public, just as the CDC says. Good news is I see lots of people out there wearing a mask. I try not to go out very often at all. If you'll notice, because I had some stuff I had to do in the office today, I'm in the office right now. But that is very rare for me. I'm working from home every day, and feel like trying to stay home as much as possible. And then when I go out wearing a mask, that is following the guidelines that the CDC says. So appreciate the question, Anna. Dorothy asked, did the major metros restart task force meet today? How soon will we get recommendations from the task force on when and how to reopen businesses? And then I saw on here that someone had just asked a couple minutes ago about salons, and so let me make sure that I kind of pull that into the same question. So we're looking at through the Big Four Restart Task Force how we examine each of these businesses that are currently closed. The governor's order today does not apply to Hamilton County. In fact, what he says is has consistently said is he knows that these Big Four cities need to figure out what's right for them, and so we are looking at salons and all these other businesses to make sure we know when they can open and the conditions under which they can be safe. So what does that mean? I think as Anna asked in the previous question, kind of what are the things that people need to wear? How do we need to ensure that there's the right distancing between people, whether it's salons or restaurants? We want to create the conditions that help people be safe. So the Restart Task Force has put together healthcare experts and business leaders, community members from all across the state, and is taking these issues on. I realize that many people are wanting to know the answers to these questions to get some kind of clarity. And what I believe this report will do is put together a roadmap that says, here's exactly what has to happen, here's how it happens, and here's what you need to do. I do think that it is extremely dangerous for us to set arbitrary dates and just say this is when something's going to happen without closely examining the facts. That's what I'm going to continue to do so that we can all be safe. And my sincere hope and prayer is that those facts lead us to open as soon as possible to ensure that that everybody is safe, and that we see the numbers continue to be low or that they decline even after we reopen. But it is worrisome and potentially catastrophic for businesses if we open up businesses, the numbers skyrocket, people are unhealthy, and then we have to close businesses back down. That is not a scenario that I want to see, nor does any business owner. Most business owners that I'm talking to are saying, tell me what the rules are, tell me how we can be safe. We want to open as soon as we can, but not before it's safe, and then ensure that we're hiring people back. And that's what we're trying to do with this Restart Task Force. We're going to get that information out to people as quickly as possible, meeting as often as possible to make that happen. And so hopefully you'll see something about that soon. I know we've been going about 30 minutes, and I'm looking through the various thread that we have here and the people who are commenting. I know that there are lots of people here who see on Facebook all the time partisan comments and political comments and all kinds of things about this. This is a global pandemic that doesn't care what my politics are or anybody else's. It strikes in ways that we can't control, and it is affecting healthcare workers, our elderly, nursing homes. We've had people of all ages across spectrum pass away in our community. It's serious. We have to take it seriously, and I'm so proud that many Chattanoogan's have obeyed the shelter at home, and that's why we've seen our numbers. One of the reasons I think we've seen our numbers continue to be as low as they are. We have to continue to be diligent about that. And over the course of the next several days, we're going to look at how we continue to restart our economy, given what health experts are saying, and what we need to do to ensure that people get back to work. That I know that's what individuals want to do. That the businesses are still there. So again, thanks to everybody for joining in. We appreciate you, and once again, for the next several days, continue to be safe. And I'll be back on Facebook Live on Thursday.